Good afternoon. Welcome to Professor Speaks. My name is Alex Hernandez. Alongside me is Dr. Craig Stern of Pro Pharma Pharmaceutical Consultants and Pro Data Analytics. Today we're going to be acknowledging Mental Health Awareness Month. So, according to Mental Health America, it's a website, mentalhealthamerica.com. 1 in 5 adults have a mental health condition, and after the ACA was passed, more Americans have access to insurance coverage. So for the month of May is being used to bring awareness to those in need with a mental health condition. So, Dr. Stern, what is one major issue the U.S. has in treating those with mental health conditions?
Yeah, I think this is a terribly important subject, and we haven't spent any time talking about it. The problem that the U.S. has, in a general respect, is no different than what other countries in the rest of the world have, and that is mental health has always been looked at as being kind of a side issue. It hasn't had a lot of advocates. It hasn't had a lot of people that stood up and said, this is an important issue.
Okay.
That whole issue changed about 20 years ago, and certainly there were people talking about before that, so we shouldn't deal with it. But some political people, some celebrities and others brought it to the fore, and what they did was not so much that they added expertise, but they brought up the issue that mental health is not something that we should just put in the closet. It is something that everybody should address.
Right.
What this also meant was that healthcare itself tended to separate it. So from a medical standpoint in general, physical medicine doctors who are treating common conditions like diabetes and hypertension and hyperlipidemia and hypothyroidism, stuff like that, they in general didn't have conversations with psychiatry. So if psychiatry had a patient was treating them, they didn't give that information to physical medicine. So physical medicine didn't know about it. Furthermore, insurance took it as an entirely different problem. Insurance said, well, if you put a patient into psychiatric care or into mental health care, what happens is that they called it the kind of the black hole, that effectively people would go in and they'd never come out of it. That was a reflection on techniques at the time that had to deal with Sigmund Freud and going back to your childhood and how you interacted with your parents and family and friends. And so it was a very long process to take someone through that in order to address it. However, new techniques today tend to focus more on the problems of today and how do you address those problems today versus trying to go back in your lifetime to address whatever was issues that formed your personality and your relationship to the world and all of that. Anyways, bottom line in that whole regard is that people tend to move it out of the way. And even today, we have the problem where we're treating patients and yet there are things going on in behavioral health that we don't know about.
Right.
And so as a result of that, they influence it and we don't know about it. Well, we should talk about that more in other questions, but bottom line here is that it now is part of it. The Affordable Care Act gave it funding. If funding is taken away, then we put it back to what it had been in the past, where it goes back in the closet and assume that nothing is going to happen to the rest of the care. So that's really what the major issue.
Right. So major issue is they are at risk of losing that coverage, but also you also touched on the fact that our method in treating it has changed.
It has, and it's terribly important. It's it's crucial that people who have mental illness tend to either have conditions or their lifestyles or otherwise that create further physical medicine problems, or that the treatments we give them,
Right.
Antidepressants, anti-anxiety, antipsychotic drugs, tend to either magnify or create problems, meaning there are antipsychotic drugs that tend to magnify or create diabetes or hypertension. And
Right.
so if someone's treating in physical medicine, and they don't talk to or have any capability of talking to psychiatry, they don't know that they're on those meds. So they're busy treating them.
Right.
But if they change the dose, they change therapy or otherwise, their condition changes over here and they don't know why.
Right.
So
That was actually my next question was what was the relationship between those with the mental health and leading to other physical effects, meaning leading on to diabetes and hypertension. What is that relationship really
the
like?
relationship is well established.
Mm-hmm.
It's even expanding now in more studies, but the relationship is well established that people with depression have a greater risk of heart attacks. There are greater issues with regard to infectious diseases, maybe due to their lifestyle and what they do, but still a problem. Issues with regard to drug use. So, as we indicated in the past, people who are on opiate medications also tend to use anti-anxiety drugs like benzodiazepines, and the interaction is not a healthy interaction. There's also a significant amount of gastrointestinal, cardiovascular, respiratory, infectious disease. All of these things are problems that are high in the behavioral health problem. And so it's like dropping a pebble into a lake and saying, well, the ripples don't go everywhere. In fact, ripples go everywhere. And what happens in healthcare is that if we ignore a piece of what's going on in the patient's condition and try and treat what's here, then this condition influences what's going on in the rest of the body. And in effect, we're treating just one condition and ignoring everything else. You can't do that. You can't do that in modern medicine anymore.
Is this just prescription based or is this overall mental health? I mean,
it's overall mental health.
Right.
It's the way that they lead their lives. Oftentimes, it's not a well-informed way, so they do things they shouldn't, whether they're injecting drugs, treating drugs around people who have poor conditions, poor nutrition, poor control of their environment, so they get infectious diseases or otherwise. They don't take care of themselves so effectively. They get conditions they shouldn't. And then there's drugs that we give them.
Right.
And these drugs help their mental condition, but can also create physical medicine problems. So we can't ignore what we're doing and just say, well, I'm only going to deal with this problem and I'm not going to deal with that problem. When managed care made a major emphasis when that came on board in the 70s, 1970s, it was increased when we dealt with Medicare and certainly Medicare Part D when we brought drugs into the process. It expanded with the Affordable Care Act. Now whatever is done with the American Health Care Act, it isn't so much that you have access if you can't afford it, or you have access but you can't get to it, because in this regard, these problems occur and they have to be addressed no matter what you do.
Right.
And I've already indicated that obviously there are problems with the cost and how we deal with therapy, but there are also things where we have to subset the population and look at those that have a small risk and deal with those problems, those that have a very advanced disease and high-risk problems and treat those, and people in between. Obviously, there's a cost difference in that. You can have a much lower cost for those people who don't have advanced disease versus those that have advanced disease. But the larger question is you cannot ignore a part of healthcare and say, okay, mental health, it's not attractive, it's not something we want to deal with, and yet it is influencing everything else. That we can't do.
So with that being said, what's the relationship with between psychiatrists and general practice physicians? What's that relationship like? Because one symptom is actually affecting the other. Like one diagnosis, meaning whatever mental health condition they have, is affecting their physical health. There has to be some kind of relationship between the two.
In many, in fact, generally, there is not a communication between psychiatry and physical medicine. if there is, and they're in advanced or organized groups,
Mhm.
then there are healthcare committees and groups that try and bring all this information together and try and evaluate it either from a group standpoint. I've certainly sat on those kind of groups and dealt with it on a per patient basis. And there have been groups where if one is aware, they can make a phone call and they can say, look, I'm treating diabetes. Do you have any influence on it? But in fact, and more often than not, they don't talk to each other. So as a result of that, we have a cost problem. We have a healthcare practice problem.
Mhm.
And then we have a sociological and a insurance problem. All of these groups need to talk to each other, and it is more than and bigger than just the Affordable Care Act and whether they fund it. It's more than whether the healthcare system deals with it. But you can't take one away from it and presume that the whole system is going to somehow communicate in response. Everybody has got to work together,
Right.
and that means funding, it means healthcare practice, it means how insurance deals with it, and sociologically, how do you deal with these people?
So basically, non-existent at the moment.
Non-existent. Non-existent.
With that, I mean, with this non-existent relationship between psychiatry and general practice doctors or specialty practice doctors, what are the drug interactions that can possibly occur that may be even fatal for some of these patients?
Well, I mean, these are serious. We've mentioned some of them, and we should make it more clear. We're dealing with drugs that for mildly, because they do work,
Mm-hmm.
do calm a person down who has anxiety. People who have severe depression can be treated and can lead normal lives.
Right.
That doesn't mean that you treated depression because you woke up this morning and you're unhappy because of something that happened in your life. That's not a severe depression.
Right.
So it has to be something that is an endogenous depression that you're dealing with. And then, of course, psychoses. Those particular conditions are things that can be treated. And in that regard, stimulants and opiates don't mix with anti-anxiety drugs. They can either make them much worse or they can kill a person in effectively taking the brain, the sensorium, and depressing it so much that it can be deadly. It can also be something that harms them. They could be in a car and driving and be depressed and get in accidents. They could hurt somebody else. They could hurt themselves. In the case of, and that happens clearly with antidepressants as well.
Right.
With these drugs that can stimulate or can cause further depression. So drugs for depression with anti-anxiety drugs, with alcohol, with barbiturates, with benzodiazepines, with other drugs, those can all be significant. If you take enough of them, those are deadly. If you don't take enough of them, you're just doing it, you depress it, even if you don't recognize that you're depressed, so that you can hurt yourself and fall, or you can hurt somebody else if you're in a car, a moving vehicle, or otherwise. And antipsychotics provide a whole different realm of problems in that, as I've indicated, they either create or they magnify blood pressure. So you can take somebody who has high blood pressure and make it worse.
Right.
Or you can take someone who you don't think has it, and all of a sudden it appears that they have high blood pressure. Similarly with diabetes, in some cases with issues with regard to hyperlipidemia, etc. So you're dealing with conditions where you're either creating, magnifying, or you're creating combinations. And the really scary part about this is that in many cases, you are on these medications, you know it, and so you're aware that you have it. But in other cases, you're on these medications and you don't know it. You don't realize that your sensorium is depressed.
Right.
Or even elevated. And in some cases, then you take things that you shouldn't do, but you're not aware that you're doing it. And as a result of that, you create problems.
Well, that's all we have for today. And one major thing that we need to focus on especially with mental health awareness, is communication between patients and the doctors. Um, whether you're seeing a psychiatrist, whether you're seeing a general practice doctor, or you're seeing both, communication amongst both of them, and it goes to the doctors too. Communication with your with your patients. Patients communicate with your doctors. Honest communication is what we want to focus on with Mental Health Awareness Month. Um, so we want to ask you guys to visit our RxInfoX page on ProPharmaConsultants.com. We'll have new videos every Wednesday at noon. Please like, share, and subscribe. And if you have any comments, please leave them below. Thank you very much.